Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Patient safety is often framed as awareness or education or even culture, but patient safety failures usually point to or reflect how systems are designed, how they're governed, and how they are incentivized. Because when patient safety fails, who is it that the healthcare system is really designed to protect? So joining me on the show to discuss the issue of patient safety further is Manvir Victor, who is the founder of the healthcare portal Vital Signs Asia. He's also the founding chairman of the NGO Patients for Patient Safety Malaysia, and he also holds an international presence as a board member of the WHO Global Advisory Group on Patient Safety. Manvir, welcome to the show. It's good of you to join me.
Thank you, Melissa, for having me.
I want to begin by getting the definitions right, or understanding what it means. So when we talk about patient safety, when we talk about the patient voice, what are we actually talking about when it comes to the everyday setting of healthcare?
Okay, I think first of all, in some countries, the terminology is a little different.
Okay.
In Malaysia, it's patient. Mm-hmm. In other countries, it's the consumer, it's the user, it's the person with a lived experience, which also includes the family members, because sometimes you're caregivers.
Right.
You're caregivers, right? So you are the person who's in the system looking after someone else. So you are also a user, a consumer of the system, right? So in Malaysia, the word is used patient. Mm-hmm. When I first started in this journey, 26 years ago actually, when I fell ill, right? I started in this journey. I always used to say the word patient is very important. Now I've realized that over a period of time, the word consumer is more important, or user. Now, the reason why is because healthcare was created to help people live their lives better. You're ill, you need to get well, all these things happen. And healthcare, the word, is a one word. It's not two words. It's not health and care, it's healthcare, right? So it's fused together because the care needs to come with that, right? And a very key component of that is understanding what the user of the system is there for, right? And it's myself, it's family members, it's people who are suffering, right? So it's about that care, the health and the care that goes with it, right? So let's back this up a little bit and look at the landscape first, right? Now, the world has about 8.2 billion people, right? Malaysia, our population is 35 million, right? Healthcare staff in the world is 70 million to take care of 8.2 billion, right? In Malaysia, our entire infrastructure for health, private and public, has about 350,000 staff, right? These are doctors, these are nurses, these are radiologists, these are paramedics, these are janitors, these are allied health, everything 350,000 taking care of about 34 million plus. This is an huge odds, right? How do you do that? So having the consumer involved in it, because I'm the guy who goes to the hospital. Mm-hmm. We've got family members, you've got friends who go to the hospital, and we are people who see the system from the other side. We are the users of the system, right? And as we go in to use the system, we find that things could be a little bit better, right? So this is the importance of having that patient voice, is actually having the consumer voice to come in and tell, excuse me, I think we can do this more efficiently, better, and faster. Everybody wants things faster. We are in this instant generation today, right? Where everyone wants things faster. So how do we get there, right? And unfortunately, in my experience when I'm looking at it, sometimes, and I joke with a lot of my doctor friends, there are too many doctors in healthcare. And what I mean by that is, a doctor is great when he's sitting across you and helping you with your illness. He can't actually help you with your parking issues. He can't actually help you with the time that you're spending in hospital, right? That is a whole different mindset.
But I guess it also very much contributes to the experience of healthcare.
Yeah, absolutely. So when we go to a hospital, and this is the complaint that everybody has is, I have to go tomorrow to do my blood test at 8:30 in the morning. So I rock up at 7 o'clock. So I jammed up the parking lot at 7 a.m. to go to take my blood at 8:30, and the counter opens at 8. Right? And so there is this whole gamut of people there. And how do we make this faster? Right? Now, if you look at the airlines, and I love the airlines comparison, because ever since I started in healthcare, a lot of people, older people who are more experienced, will tell me that we should compare healthcare to the airlines and the safety record.
Ah.
So I went a little bit bigger and I said, let's look at the entire airlines. We get in on flights, 200, 300 people, it's seamless. Why are we able to do that seamlessly, right? Whereas 200 or 300 people in a hospital to take blood, it's a jam.
Right.
It's absolute gridlock there, right? So how do we use other industries to help process people faster?
I love the airline comparison because you're right, this process is seamless. Everyone knows the process, so there's no really kind of vagueness about where to go, what to do. But are these apples to apples comparisons? Meaning, does healthcare have the same kind of public interest view or profit-driven view similar to all these other industries?
Well, I think at the end of the day, healthcare is a human right. If someone is ill and they continue to be ill and they can be healed, if there is medicine to heal that person, why are we not healing that person? So now it's an affront to that person to not heal that person. So it's a human right, right? So it's not a profit-driven. It should not be profit-driven, right?
But is there an incentive for it to be efficient and patient-centered?
Of course, it has because if you are efficient and patient-centered, you end up saving more people. That's the core thing at the end of the day. Malaysia, we have a fantastic access to health in the sense that I think about 95% of our population has access to either a clinic or clinic kesihatan or anything within 5 kilometers of where they are. That's fantastic, right? But do we have the equity? Because when we go to the hospital, we have to wait for hours and hours and hours. So this comes back to the proposition of the idea where you've got 350,000 people taking care of 34 million. That's just, I don't envy the person who has to do that. But being the 34 million, and I'm going to the system and I'm saying, how can we make this faster? How do we improve this, right? And having that patient voice in there to help them improve the system. That's all what we want.
Right. Because there is an opportunity cost when systems are not efficient. Tell me, Manvir, how much influence does the patient voice actually carry when you have these? When you think about the governance of healthcare, I'm just wondering what happens when you have a patient voice or patient perspective that is in direct conflict with the institutional priorities, be it cost, be it investment or legal or risk even. Yeah.
Well, this is where I think as a patient, as a person, as a human being, the reason for that business is to save people's lives. That's it. It's not to make people fly from point A to point B, right? Like the airlines. It's to save people's lives. So the more people you can save, the better you can give them life. This is all great, right? So that is the core of what they are there for, what the industry is there for, is to create and have people healthy. A healthier nation means a more productive nation, right? So I'll tell you that I was on dialysis for 10 years. And being on dialysis means that I couldn't work, that I had to take from the system rather than giving back to the system. Now, since I've had my transplant in 2012, I'm able to work, pay taxes, do all these things. So my perspective sometimes as a patient is clouded in a way when I look at myself and say, I'm a taxpayer, I'm a voter, then I'm a patient. Because I am a taxpayer and a voter 24/7. I'm a patient maybe 1 hour of the day. Right? So that should be important for people to realize that a healthier me, a healthier nation means that there's more people productive giving into the system rather than taking from it, right? So from a national perspective, every country looks at it and says, the sick people, how do we reduce that sick people, right? So that's, again, health care, because it's the promotion of health among the nation, right? So that a healthier nation, can you imagine that, I mean, maybe in a dystopian world or something, that no one falls sick ever? Can you just imagine that? Can you imagine how happy people will be?
Yeah.
Right? And that's what we want at the end of the day. And, so if you're happier all the time, you probably have less mental health.
Yeah.
There's a lot.
Because without health, nothing else matters, right?
Absolutely.
Okay. So we've talked about the patient voice. Let's look at patient safety.
Okay.
And how that is centered in healthcare governance. When patient safety fails, who does the system protect? What happens when patient safety fails?
Well, patient safety is supposed to save the patient, right? Now, I have to be very honest in the sense that this is a 24/7 business. You walk into a hospital with a stomach ache, it could be a myriad of things that you have, You could be having an ulcer that's going to burst. You could be having appendicitis. There's a ton of things that can happen to you just from walking into an emergency with a stomach ache. So the doctor on call, the person there, he's got all these issues, right? And he does that not for 1 hour a day. He does that all the time. And I'm sure that in government, our doctors are very, very good, really. But they are stretched thin because, they've got 30, 40, 50 patients to look at, and then go for his ward rounds and maybe do surgery and maybe do follow-up. So these guys see 50, 60 patients a day. So that the chances of any sort of mistake, whether it's the doctor's mistake or the nurse's mistake or the pharmacist's mistake, is very high because you're literally at DEFCON 3.
Yeah, you're operating at those levels, right?
So the chances of mistakes happening is very, very high, right? But there are policies and processes put in place to make sure that it doesn't. But let's say something slips through, and it does. I'm sure it does on every single day, whatever clinic you are, it does happen. So when it happens, everyone needs to sit down and say, okay, what they do is they call this a root cause analysis, an RCA. So they sit down, they have this RCA, and they try to figure, okay, what went wrong? Where was the mistake? Where did it actually happen? How do we stop this from happening again? And so now, currently they all sit down, the clinicians sit down, and they understand better, oh, okay, I made this mistake, or, I didn't, my writing's not great, whatever it is, those mistakes happen, right? Because they are rushed. But how do we solve it so that it doesn't happen again tomorrow? And this is what they do quite well. Having patients involved in it also does help them understand the patient's point of view.
Right.
Because I've met a 55-year-old lady who had breast cancer. She was terminal, but she didn't want any medication. She said, all I want is to see my daughter get married. That's it. And then I'm done. Her daughter obviously didn't want that, but that's what the mother said. I don't want to go through chemotherapy because I don't want to lose my hair. She assumed that's going to happen to her. But so having that patient voice, meaning that you have to give respect to that person. I said, okay, this is your point of view. Okay, this is what you want, right? And giving them that personalized choice to decide that this is what I want with how I'm doing things. The same goes for medications that you give across, I've had patients come up to me and ask me for advice, and my doctor gave me 20 medications. I'm a transplant patient, so I've got about 25 medicines that I have to take a day, right? And if I stop taking one, it causes another problem, right? But I have to be diligent in the fact that I'm taking it. And some other patients who are having other illnesses, they just feel it a chore to take their medicines. So they come up to me and I said, you have to listen to your doctor. You have to trust your doctor. Your doctor is thinking the best for you, and he has given you this medication. Sometimes you need to be on it for the rest of your life. Sometimes, because of lifestyle changes, you can get off it. But have those conversations with your doctor. And a patient advocate has that ability to talk to other patients at their level.
Okay.
I can spend more time with a patient than a doctor can. merely because I don't have 50 patients to see a day. Maybe I have 3 or 4. So that really helps us be able to understand that patient a little bit better and tell them, you know, we want you to take this medication. We want you to go through this process. I know it's tough, but listen to me.
All right. Are patient advocates an inbuilt part of the healthcare system? Is this generally practiced worldwide to have patient advocates be part of a patient's experience in,
yes,
in
they are.
the healthcare?
In other countries, they are very, very well versed. In some European countries, when you want to build a hospital in some place and you've got a budget of whatever, 40 million euros or whatever to build a hospital, the first people you engage is the patients, and you tell them, okay, we are building a hospital, your committee. What do you want it to look like? What would you like in this? Because it's a community hospital. Then you ask the clinicians, how do you want the surgeries? How do you want that part? Because that part is going to be set in stone. But the part that you are able to change is to make people comfortable coming to the hospital, wanting to come to the hospital. Because some places in the world, they don't want a car park. They say, no, we don't want a car park, we'll take the train in. We want to do things like that. So that is that community. So there's no one size fits all, but having the patients in other countries where you're able to share your opinion, and then people look at it and say, yeah, that's a good idea. Let's do it that way. We're going to spend money. We're going to build a hospital. Let's build something that you are happy with, you know, because you're coming in when you're ill.
How much power does the patient have? Because again, many people who are ill, you know, car parks and ease of experience is not top of mind. It adds to the experience. It can be an inconvenience. It can be more than inconvenience. It can be the worst part of the day. But they're there with other worries on their minds. So how much power does a patient have in, I guess, shaping what healthcare governance looks like? Do hospital operators, hospital governance boards, do they listen to what the patient wants and what the patient needs?
In Malaysia, now they are starting to listen.
Okay.
Now they are starting to listen. They are understanding that the patient voice is very important. A lot of them that I work with tell me that, you know, people complain about their services because let's face it, like you go to a restaurant, the food is fantastic, you don't tell anybody. But the food is rubbish, you will tell everybody, right? This is human nature, right? So they will get the bad reports. And I tell them, yes, they're bad reports. Look at the bad reports and say, how do I improve that? Did we make a mistake? We improved that. But where are the good reports? Where are the good stories? Because I've been this patient for 26 years. I've had good experiences. I've had bad experiences.
Right.
But I want to remember the the good ones, because I tell everybody, I had this really good experience, and then everybody goes, oh, yeah. And when I tell them that great experience, they go like, oh, but you're the only single voice. I say, I'm not. You're just not listening.
Right.
You're not engaging with people and asking them, what do you like about my facility?
Is that part of your role? So you are on boards of safety councils nationally and also globally. Do you then engage with healthcare leaders to say, this is what we need, this is what we like, is that the role of these bodies?
So
okay.
I try to best enhance what they have, right? I try to best enhance, and I ask them to also improve, think the next level, right? One of the things I always joke about is my Grab app knows more about me than my hospital does. It knows when I want pizza or whatever, and it gives me those deals. My hospital never does that. You understand? And there are two different apps. But why is it that information is not used to better my life? You know, on one side, I'm getting promotions and deals to be unhealthier. What's there to make me healthier? So we live in this world today where it's a digital world. Everything's available. And how do we keep that conversation going? Because at the core of this, you're talking about healthcare. What is the proposition that healthcare can promise you? They cannot promise you an outcome. You can't go into the hospital and know that you're going to walk out healed and everything's going back. They can't promise you that. What they can promise you is, trust me, the hospital, that I will do my 100% for you. That's trust, right? And trust takes a relationship. It's not built overnight. It takes time to build that relationship. Now, as I walked in here today, I realized that 30 years ago today, I walked into Astro to work here, right? And so you look at that brand of Astro and consider this as one of the programs there. Now, you're a trusted brand. You're a trusted brand. The people in this building have changed, but the brand remains trusted. And that is what exactly healthcare organizations are trying to do. So it's not built on one particular doctor, one particular CEO, but an entire brand. And it's that trust that Astro has with millions of people.
Right. I see, so in my role as journalist, I speak to a lot of medical associations, and there are associations that talk about the doctors' welfare, well-being, and then nurses and allied health professionals, and all the different components that make up healthcare. Who's fighting for the patient? Who's fighting for patient rights, patient education? How would we, as patients, know what it is that we can and cannot demand for in a healthcare setting?
So, unfortunately, we learn about this through negative things. You know, when somebody sues the hospital and then you find out, hey, this kind of mistakes happen. Because they do. They do.
But
right?
it's not very public, is it?
Is it
public?
there are a lot of cases that are becoming public now. Our medical litigation is going up year on year.
Oh dear.
Right?
Okay.
So, because we are getting more ill, we are getting more aged society, a lot of these things happen. And when hospitals don't have enough space, it means that you're running at full capacity.
Right.
Chances of mistakes are there, right? So it's not that they intentionally, it just does happen. It's not perfect, right? It cannot be perfect because it's human. It's built around human beings. Doctors, nurses, whatever, patients, they're all humans, right? So having that there is very important for people to understand that this is where the landscape is. The doctor or the facility did not mean to harm me, but the harm did happen. We find out about what our rights are when it's a bit too late. But what we are trying to do is have those voices also there to tell people you're doing the right thing. Yeah, you're up against it. There are so many people in your hospital, but you're doing the right thing here. You're doing the right thing there. How do we improve on it?
Right. Manvir, is there enough transparency when medical harm happens, unfortunate as it is and human as it is? When medical harm happens, is there transparency in the system that everyone knows and can learn from what it is, so that patients know this is a right, and then the system also knows we need to correct this?
In a word, no. I would like them to be more of that, because you look at it and you understand the mistake, and you probably tell everyone, we made this mistake, you made this mistake. Because I can tell you there are a lot of times when I've had situations myself where when a doctor tells me you're supposed to take this medicine at 10 o'clock and I forget and I take it at 11 o'clock. So that's my mistake, right? But I have to own up to it. And I tell my doctor, I forgot to take this medicine, or I didn't take it correctly. You told me to take it this time, but I did. So we are also responsible for it. So we do contribute to that mistake being made. So if we are transparent, everyone can sit down at a table and say, yeah, okay, I made this mistake, you made this mistake. How do we move forward from these?
How do we have accountability?
There's not enough transparency there. We don't have that. And I would blame the lawyers.
Okay, talk to me about how what disincentivizes that transparency?
I think the fear of litigation. It's the fear of litigation that people are afraid, if we own up to this mistake, we're going to get sued for it. But I think, if you think about it from a different point of view, if there are people are like myself, and I'm here sitting down as a patient advocate, advocating for healthcare. Right now, I've been telling you that doctors are up against it, nurses are up against it, all these things, right? And I'm telling you, they will make mistakes. And honestly, a lot of them that I know are trying to do their absolute best. Sometimes, somewhere, there is a gap. They don't mean for it to happen, but it does happen, right? So how do we improve that?
Yes.
If we don't recognize that there is an issue, we can't solve the issue. And that is where the lack of transparency frustrates me, because I see it's happening. If it happens 3 times, I'm like, okay, so are you waiting for the 4th time, 5th time, 6th time?
Well, is there anything you would change to make transparency a bit better, a bit easier, make it easier for all parties to talk about what happens when patient safety fails?
So part of what WHO does is to have patient advocates like me, and we are training more patient advocates. And these patient advocates are supposed to sit down on hospital boards. There's a board of visitor in the hospital. So the board of visitor in the hospital will have the director of the hospital, a few key people, the clinicians and the nurses, but we also should have patients sitting inside there to give the patient's point of view as a consumer, user of service in that hospital and say, hey, wait a minute, you have this great plan about starting a blood test at 7 o'clock in the morning, but there's no parking spaces because at 6 o'clock it's going to be
full. Yeah.
How do we do this process faster? So
Right.
the patient who's using the system, who's sitting down there and waiting for 3 hours, that's the point of view that we have to hear.
Manvir, thank you so much for being on the show, giving us an insight into why it's so important that we center the patient voice in healthcare. I appreciate your time.
Thank you so much.
That's all the time we have for you on this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching. Good night.